Assalamualaikum and hello everyone. My name is IZZAH binti TARMIZI from class B2, and today I'd like to share with all of you about a medicine that is quite popular among Malaysians. This is because this medicine is often used to treat a disease that are quite common in this country due to hot weather. The disease is called a rash. Therefore, the medicine that I'll share today, as it has been shown on the screen right now, is called Benadryl cream. So this is how Benadryl cream look like. Now let's learn together about the function of Benadryl cream. Benadryl cream is used to treat rashes on the skin. The picture shown on the screen right now is an example of a rash on the face of a baby girl. Now let's get to know a little bit about the disease. A rash is defined as a widespread eruption of skin lesion. It is a very broad medical term. Rashes can vary in appearance greatly, and there are many potential causes. Because of the variety, there is also a wide range of treatments. A rash can be local to just one small part of the body, or it can cover a large area. Rashes come in many forms, and common causes include contact dermatitis, bodily infection, and allergic reaction to taking medication. They can be dry, moist, bumpy, smooth, cracked, or blister. And they can be painful, itch, and even change color. Now let's compare and contrast the two drugs. Actually, both medication can be used to treat rashes, but why I prefer to choose Benadryl cream over zinc oxide ointment is because of its properties. As you can see on the screen right now, both medications are widely used in treating a variety of skin conditions, and both are from semi-solid dosage form. However, Benadryl cream offer a better characteristic compared to zinc oxide ointment. First, Benadryl cream is easily spreadable, while zinc oxide ointment is less spreadable. Besides that, Benadryl cream also offers rapid absorption and rapid onset of action, while zinc oxide ointment offers slower absorption and slow onset of action. Therefore, Benadryl cream can provide a faster effect to cure disease compared to zinc oxide ointment. So this is the reason why I choose Benadryl cream over zinc oxide ointment. Now let's learn about the uses of the drug. So this medication is used to temporarily relieve itching and pain caused by minor cut, sunburn, insect bite, or rashes from poison ivy. So diphenhydramine belongs to a class of drug known as antihistamine. So how it works? It works by blocking the effects of a certain natural substance. We call it as histamine that causes itching. So this product may also contain other ingredients like skin protectant such as allantoin and zinc acetate that may help relieve symptoms such as dry skin, weeping, or oozing. Now let's learn about the application of this medication. First, use this medication only on the skin as directed by your doctor. Second, before applying, clean the affected area with soap and water. Gently pat dry, apply to the affected area as directed, usually no more than 3 to 4 times a day. Third, do not use on large area of the body or use more often than directed. This is because your condition will not improve any faster, while your risk of side effect will increase. Fourth, avoid getting the product in your eyes, nose, ears, or mouth. If the medication gets in this area, wipe it off and rinse the area right away with water. Lastly, stop using this product and tell your doctor if your condition worsens. Lastly, what are the safety precautions need to be taken while using this drug? First, before using this product, tell your doctor or pharmacist if you are allergic to diphenhydramine. Second, before using this medication, you need to tell your doctor or pharmacist your medical history, especially if you are self-treating. Third, stop using this product and tell the doctor right away if any of the following serious side effects occur. And lastly, during pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefit with your doctor. I think that's all from me. Thank you for listening.
Assalamualaikum, my name is AZLIZA BAHSARI and I'm from group C2. I have chosen mupirocin as my semi-solid medication for eczema. And here I have chosen mupirocin in an ointment form. Alright. Eczema is a skin condition that is characterized by intense itchiness, redness, dryness, and sometimes blistering weeping or crusting arising from inflammation of the skin on small patches or large swatches of the body. People with eczema typically have dry and sensitive skin and can easily fall into an itch scratch cycle, triggers itching, resulting in scratching, which triggers more inflammation and in turn more itching. And here, this is the picture that shows the condition of eczema. Alright, indication and dosage for adult is as 2% ointment applied to affected area 2 to 3 times daily for up to 10 days according to individual response. It is the same dose for child and elderly. Special precaution. Patient with extensive burns or open wounds must take precautions if they want to apply mupirocin. Besides, this mupirocin is not indicated for treatment of pressure sores. Furthermore, renal impairment, children and elderly, pregnancy and lactation. The storage of mupirocin is it must be stored below 25 degrees Celsius. Do not refrigerate or freeze. Moreover, this mupirocin must avoid from contact with ice and mucous membranes. The adverse reaction of mupirocin is firstly eye disorders such as burning and tearing of eyes. Secondly, gastrointestinal disorders such as nausea and dry mouth. Third, general disorders and admin site conditions such as application site reactions, localized burning, stinging or tingling sensation, localized pain and swelling, irritation and soreness. Fourth, nervous system disorders such as headache and dysgeusia. Alright, these 3 pictures are some of the example of mupirocin ointment. Okay, how to use mupirocin ointment? Alright, first, wash your hands with soap and water before and after using this medicine. Second, apply a thin layer to the affected area of the skin, rub it in gently. And third, after applying this medicine, the treated area may be covered with a gauze dressing if desired. And this is the example of gauze dressing. Alright, I will moving on to the compare and contrast between mupirocin and tacrolimus. Both of them are for eczema. The dose for mupirocin for adult is as 2% ointment applied to affected area 2 to 3 times daily for up to 10 days according to individual response. It is also the same dose for child and elderly. Meanwhile, for tacrolimus, for adult as 0.03% or 0.1% ointment applied thinly to affected area twice a day. If no improvement after 2 weeks, consider further treatment options. Maintenance as 0.1% ointment applied thinly to affected area twice weekly, 2 to 3 days between applications for up to 12 months in patients who respond to up to 6 weeks of twice a day treatment. On the other hand, for child 2 to 16 years old as 0.03% ointment apply thinly to affected area twice a day for up to 3 weeks. Maintenance apply thinly to affected area twice weekly, 2 to 3 days between applications for up to 12 months in patients who respond to up to 6 weeks of initial treatment. Besides, the storage for mupirocin is stored below 25 degrees Celsius. Do not refrigerate or freeze. Meanwhile, for tacrolimus, store at 25 degrees Celsius. Store between 5 to 25 degrees Celsius. And this is the example of mupirocin ointment, while this is the example of tacrolimus ointment. Alright, I think that's all from me. Thank you.
Good day everyone, my name is IZZATI MAISARA binti SUHAIZAM 2020-855-424 and I am from class B2. Today, I am going to present about one of the semi-solid dosage form which is cream. The cream that I want to talk about today is Mometasone Furoate Cream USP. So this is the overview of today's presentation. Firstly, the introduction to Mometasone Furoate Cream USP. So what is exactly Mometasone Furoate Cream USP? Mometasone Furoate Cream USP is a type of topical corticosteroid. It is classified as potent corticosteroid. Mometasone Furoate Cream USP is very useful to reduce redness and itchiness of certain skin problems such as psoriasis. So next we move on to the introduction of the skin disorder. So the skin disorder that I have chosen is psoriasis. So what is psoriasis? Psoriasis is the condition of skin where the skin cells multiplies 10 times faster than usual. So there will be bumpy red patches with white scales on the skin. A person who encountered psoriasis will have itchy, scaly and redness skin. Psoriasis can be grow on everywhere on the surface of the skin, such as on the scalp, knees, elbows and also on the lower back. Psoriasis can be healed but it will grow back again. This is the comparison of skin condition between healthy skin and skin that have psoriasis. There are few ingredients that contain in a tube of Mometasone Furoate Cream USP, which are Mometasone Furoate, hexylene glycol, purified water, white beeswax, dilute phosphoric acid, titanium dioxide, white soft paraffin and sterile alcohol. The active ingredient in this cream is Mometasone Furoate. Mometasone Furoate is a white or almost white in color cream. Mometasone Furoate has a smooth texture as there are no visible particles can be seen. What patients need to know before using this product? Patients who have wounds, dermatitis around mouth, chickenpox, shingles, warts and also skin ulcers are not advised to take this preparation as it may worsen the condition of their skin. Before using this preparation, a patient needs to be counseled by a qualified doctor or pharmacist to make sure that the ingredients does not cause any harm to their skin. So firstly, on how to use the cream, we take a small amount of the cream by using our fingertip and then we spread evenly on the affected part. That's how the video is. Furoate Cream USP may also cause several possible side effects, which includes burning, redness, itching, acne, blurred vision and also excessive hair growth. Mometasone Furoate Cream USP does not have any specific or complicated ways to store them. So patients should ensure that this topical application should be kept out of reach of children, do not be refrigerated or be freezed, should be discarded after 3 months after opening and cannot be used after exceed the expiry date that has been stated. It also should be stored above 30 degrees Celsius and the use of this cream should be stopped if any irritations happen. Finally, compare and contrast between Mometasone Furoate Cream USP and clobetasol propionate ointment. So both of these medications are topical applications and they are used to treat psoriasis. So for the Mometasone Furoate Cream USP, it is well absorbed on the skin, easily washable and does not greasy. Meanwhile, for the clobetasol propionate ointment, it leaves a thin film on the skin, hard to wash off and greasy. So that's all from me. Thank you.
Assalamualaikum and good morning. My name is SYAFIQA binti Jeffrey and my student number is 2020601156. Today I'm going to present about this Nixoderm ointment. Did you know that this ointment is available in your nearby pharmacy? So what are the uses of this ointment? This ointment is a medication used to treat mild to moderate acne. So what is exactly means by acne? Acne is a skin condition when your hair follicles become plugged with oil and dead skin cells. Thus, it causes whitehead, blackhead or pimples. Acne is almost common among teenagers, though it also affects people of all ages. Acne also can cause emotional distress and scar the skin depending on its severity. The earlier you start treatment, the lower the risk of such problems. Besides pimples and blackhead, Nixoderm also treat itchiness, rashes, and ringworm. So I want to tell you that stop feeling unconfident due to this problem and start using Nixoderm ointment instead.
So what does this Nixoderm ointment looks like? First, the color is very light yellow, it is opaque, and it also has a faint odor of menthol. The texture is a bit greasy due to the content of oil in the preparation. And lastly, it is available in 2 sizes in a green and round can.
Nixoderm is an over-the-counter product registered under this number MAL 19984125XC. So, what does this ointment do? This ointment adheres to the skin and it is formulated to keep its active ingredient in contact with the skin for the maximum amount of time. Thus, this gives better results than liquid or thin application that quickly run off. So what does this ointment contain? Its active ingredient contain benzoic acid 6% weight over weight, salicylic acid 2.5% weight over weight, and precipitated sulfur 4.6 weight over weight. Other than that, it also contains inactive ingredients such as hard, liquid, and white soft paraffin, and it is also contain titanium dioxide, kaolin, and menthol. So let's move to the function of each active ingredient. First, we have benzoic acid. It is used to provide good antifungal properties. Next, we have salicylic acid. Salicylic acid is a keratolytic agent which treats and prevents acne. And lastly, precipitated sulfur is a mild antiseptic, antifungal, and parasitical agent. So for patient information, what you should know before using this ointment. You must not use this ointment if you are sensitive to any ingredient of the ointment. Next, if you have extremely sensitive skin, Nixoderm ointment may cause slight smarting, so it will be wise if you apply a thin layer of petroleum jelly over the affected area before applying this ointment. So let's move on how to use this Nixoderm ointment. For the treatment for either acne, eczema, and rashes, you can follow this step. First, after cleansing, apply gently but truly a liberal amount of Nixoderm ointment to cover the entire surface. This should be done twice daily, in the morning and evening. The treatment should be followed for 7 days, then discontinue for 3 days, and then resume for 7 days. Lastly, continue the pattern of the treatment until the condition has cleared up. For now, no known side effects have been reported for this product. Next, you should take note of this. It would be best if you avoid contact with your eyes. If any irritation occurs, you should discontinue using this product.
Now, let's make some comparison between this ointment and other acne medication. So, we look into the compare and contrast between Nixoderm ointment and Himalaya acne and pimple cream. We can compare these two according to these parameters, which are the consistency, greasiness, washable property, and lastly, the spreading ability. Nixoderm ointment has a thicker consistency than Himalaya acne and pimple cream. Nixoderm also are more greasy, not easily wash off, and less spreadability than Himalaya acne and pimple cream.
Lastly is the storage of this ointment. You should store at 25 degrees Celsius in an airtight container and protect from light. And lastly, the important thing is you should keep out of reach of children. Thank you, that's all from me.
Assalamualaikum warahmatullahi wabarakatuh, and greetings to my lecturer and my fellow friends. Today in my slide, I would like to talk about one of the semi-solid dosage form that is used to treat acne, which is different adapalene gel 0.1%. So the description, it is previously available only by prescription. It is approved by FDA, Food and Drug Administration. It is dermatologist developed and tested. It is a once daily topical retinoid, and it will occur a oil-free condition for your face. The ingredients used for the gel itself is adapalene 0.1% retinoid, carbomus 940, edited disodium, methylparaben, poloxamer 182, propylene glycol, purified water, and sodium hydroxide. So the uses of the product itself, it is used to prevent breakouts, blackheads or whiteheads, blemishes, and clogged pores. It is clears acne with the power of the medications and formulation itself, restores skin tone and texture by clearing the acne. It also can treat acne, which is acne, that is caused by wearing face masks and facial coverings for too long, because it will affect our skins at this kind of part. So how does adapalene works for acne? Adapalene is a medication that used for treating acne. So it belongs to a class of medication called retinoid. It works by affecting the growth of cells and decreasing swelling and inflammations. So how to use adapalene gels? First of all, you need to clean the skin. You need to clean the skin gently and pat dry before applying the product. And then you need to cover the entire affected area with a thin layer, which is mean if acne is occur on your face, which means you need to apply all of your face. Do not use more than one time a day, because apply more may not provide faster or better result, but may worsen the skin irritation. So the products need to keep out of reach of children, and you need to store it at room temperature 68 degrees to 77 degrees. So precautions for the product itself, it is for external use only. Also do not use on damaged skin, which is cuts, abscesses, eczema or sunburn. Do not use if you're allergic to adapalene or any of the ingredients in this product, and also if pregnant or breastfeeding, ask a doctor before using. Compare and contrast for this product. So I would like to compare with adapalene 0.1% gel with tretinoin 0.025% gel. So adapalene is available without prescriptions, while tretinoin available only with prescriptions. Adapalene causes less irritations than tretinoin according to the studies. Meanwhile, tretinoin causes more irritation more than adapalene.
Hi everyone, my name is FATIAH BINTI Muhammad FADZIL. My student ID is 2020845982. Today, I want to present to you guys about insects bite and the product called Mopico. I'm sure you all have heard about this product, right? Because it is famous in Malaysia. Let's move to the next slide. As for the overview, most insect bites and stings are not that serious, which means that it can be cured within only a few hours. But for some reason, they can also become infected caused by severe allergic reactions such as anaphylaxis or spread serious illness such as Lyme disease and malaria. In addition, when insect bites the skin, the body will determine its saliva to be foreign and dangerous substance. As a result, the immune system will produce the chemical histamine. The chemical histamine that causes skin to swell and itch if you can't stop scratching. You may also increase the possibility for the bacteria to enter your body. Mopico contains 3 ingredients, which are menthol, camphor, and meticillicin. Each ingredient have their own function. For menthol, it is used to soothe irritation, while camphor used to stop the irritation. Lastly, meticillicin function is to ease inflammation. Next is the uses of Mopico product. Mopico is famous known as a medication to relieve itching and irritation caused by insects. It is also function for relieving the minor itches and pain of muscle and joints associated with rheumatism. Let's move to the next slide, which is patient counseling information. Patient needs to hear this carefully. Please avoid this medication from entering your eyes, nose and mouth. Second, only apply a thin layer of the Mopico ointment to the skin. If you put it too much, it may result in peeling. Peeling is a term used for a condition which is the ointment did not absorb to your skin. Lastly, don't ever apply it on infected area because it may worsen your skin. We move to the side effect. After you apply the ointment, you may get the feeling of warmth, allergic, contact dermatitis, and restlessness. Caution, storage, indication, and dosage. Caution for Mopico ointment is Mopico ointment only for external use. As for the storage, you must store it at room temperature. And as the indication and dosage, the patient should apply the Mopico ointment 3 to 4 times per day. Rub an adequate amount into the affected area. For the contraindication, this product is not suitable for kids below 2 years old. Make sure to keep out of reach of children, okay? So that your baby is safe and something bad will not happen to them. As you guys can see this picture beside me, this is how the Mopico ointment packaging looks like. The color is green. You guys can check this out at any convenience store or independent pharmacy because Mopico ointment is an OTC medication. Do you know what is OTC medication? OTC is the term used for over-the-counter drug, which you can get the medication without any prescription. Let's make a comparison and contrast between Mopico ointment and a bite cream. Mopico ointment is a bit greasy and it is not suitable for kids below 2 years of age, while a bite cream is a non-greasy medication and it is safe to use for the babies. Both Mopico ointment and a bite cream function are to relieve itch due to mosquito or other insects. That's all from me. Thank you and goodbye.
Hi, Assalamualaikum warahmatullahi wabarakatuh, and good day I to my lecturers and friends. Today I will explain about benzoyl peroxide gel, which is one of the semi-solid dosage form for acne treatment. So, to treat acne, firstly we need to know what is acne. Acne is actually skin disorder that caused by inflammation of skin glands and hair follicle. So, there are variety types of acne, and the 6 common type of acne is pustule, blackhead, redhead, papules, cysts, and fungal acne. Okay, let's proceed to how benzoyl peroxide gel treat acne. So we need to know what is benzoyl peroxide gel. So it is actually antiseptic that works by killing bacteria on the skin surface, and then by killing the acne causing bacteria, skin may become dry and pale because benzoyl peroxide also remove the excess sebum on the skin. So there will be less oil production on the skin, and it also can be used to treat mild to moderate acne. Okay, so let's proceed on how to use benzoyl peroxide gel in correct way to avoid any irritation, as benzoyl peroxide gel can cause dry feeling on the skin. So firstly, before applying the gel, we need to ensure that our skin is dry and clean. So next, we need to apply only 1 piece size of the gel at our fingers, and then apply a thin layer only on the skin, which is the certain part of the affected area only, to ensure there is no irritation. Extreme irritation can occur at other parts also. Next, we need to make it test the allergies on our skin for 3 days. Next, we need to observe our skin. Okay, for person who can use the benzoyl peroxide gel, which is that they did not have any irritation when apply the benzoyl peroxide gel for 3 days. So firstly, they can use it on dry and clean surface because benzoyl peroxide gel actually can react with water. So when we use on the damp skin, we can easily get irritation. So next, apply piece size again of benzoyl peroxide gel on the skin to the affected part. Apply it on very thin layer only. So next, after we apply the benzoyl peroxide gel, we have 2 suggestions, which is firstly, if your skin can tolerate with benzoyl peroxide gel, you can leave it overnight and proceed with your skincare routine. And then if you are not suitable with the benzoyl peroxide gel, you can only use it for 30 minutes and then wash with clean water and then proceed with your skincare routine. Feel the burning sensation and peeling normally may occur during the first week of treatment, as
it's actually especially for the sensitive skin, and we can discontinue the product temporarily and proceed when skin become normal with less frequent amount. So this is important because we should avoid any extreme irritation on the skin that can cause discomfort to the consumer. So and we need to avoid benzoyl peroxide gel from contact with eyes, eyelids, mouth, and mucous membrane, and any colored materials such as hair and clothes, because actually it can cause bleaching on the colored material. So if any extreme irritation develops when the first week of treatment, we need to discontinue and consult the doctor to treat the irritation. So let's compare and contrast between benzoyl peroxide gel to other acne treatment gel such as clindamycin gel. So benzoyl peroxide gel is actually killing the bacteria by using antibacterial effect and killing the bacteria, and also prevent the excess sebum from built on the skin. And for clindamycin gel, it is act by as antibiotic effect by prevent the growth of bacteria on the skin. So next, actually benzoyl peroxide gel is more effective. It's proven more effective than clindamycin gel, as clindamycin gel need to be used with benzoyl peroxide gel to ensure the acne to be diminished, as it is less effective when it be used alone. And lastly, both of these acne treatment actually can treat mild to moderate acne. So we can use both acne treatment gel as long as the gel is actually sweet to our skin and do not cause any irritation on the skin. So I think that's all from me. Thank you.